If you're struggling with your weight, listen to this story. In Tennessee, where 1/3 of the population is considered obese, state Medicaid covers lap band surgery, but they do not cover preventative nutrition counseling. Several other states also have this policy. Is that backwards? Well, for a fair and balanced debate, we're joined by Dr. Scott Morris, founder of Church Health Center and author of Healthcare You Can Live With. He's a doctor in Tennessee. He joins us from Memphis. And Chantel Hobbs, a life coach and author of Love Food and Live Well. She lost 200 pounds by diet and working out. She joins us from Miami. Good morning to both of you.
Good morning.
All right, Dr. Morris, I want to start with you. Let's just do the math, okay? Counseling for a dietitian would cost the state $100 per hour. The bariatric lap band surgery costs $2,000. So why would state Medicare only pay for the lap band surgery and not for the counseling?
Great question. First, here in Memphis, we are totally supportive of the whole concept of prevention of obesity. My clinic, the Church Health Center, spends literally millions of dollars of private money for the whole concept of preventing obesity. However, once somebody is morbidly obese, they weigh more than 300 pounds, it's very clear that it is cost effective to use the surgery because one way or the other, the state will pay for the cost of that person's health care.
Sure.
Because almost every person who's morbidly obese also has either diabetes, high blood pressure, heart disease, stomach problems, chronic back pain that's going to require surgery, complications of pregnancy,
and so you might as well pay for the lap band. I hear what you're saying, but wouldn't nutrition counseling possibly stave off the morbid obesity? Chantel, I want to bring you in because you did it the old-fashioned way. You lost 200 pounds by diet and exercise.
And not only, I did it the old-fashioned way, if that's what we're going to call it, but I was the obese child. I was the obese teen. I was the obese woman. And so I have been there. I've been in those shoes. I have a tremendous heart of compassion for people that are struggling with this today as we speak. But this is what I know. I know that it's absolutely important and imperative that you get to a place where you have nothing left but your own self and where you say, you know what, I'm willing to go to work. I mean, I believe that by the state's funding this this whole concept of intervention through surgery, it's basically a bailout for the obese people. I mean, and that's coming from somebody that lived in the shoes.
Dr. Morris, quickly, your response to that?
Yeah, I have got great admiration for Chantel and what she's done. However, non-surgical intervention just doesn't work in very many cases. Less than 40% of people doesn't have any effect at all.
Go ahead, Chantel.
But Dr. Morris, the concerning thing here is that we're acting like that lap band is a magical rubber band or that any kind of bariatric surgery is magical. And isn't it just basically a forced restriction of calories, which is something we can do on our own without the risk of death and all the complications that come along with major surgery?
The issue is cost. The question is, what can the state do?
The question is, why are we paying
taxpayer dollars?
But why is it that we will take taxpayer dollars and cut PE programs, but yet we'll let mom gain a little bit more weight so she can get to that place to qualify for the state to pay for her to have any kind of bariatric surgery?
Obviously, there are lots of questions. I'm sorry to interrupt you guys. It's a great debate, and there are lots of questions whether you pay for the prevention beforehand or for the solution at the end. We will continue to debate it on our blog. Chantel Hobbs and Dr. Scott Morris, thanks so much for coming in for this debate.
Thanks for having me.
Thanks for having us.
All right.